Hello and welcome to our session, Postgraduate Psychology at Macquarie University. My name's Hannah and I'm currently in my honours year of our Bachelor of Psychology degree, and I'll be speaking with our course directors for our 4 postgraduate psychology master's programs. So we have the widest range of offerings in New South Wales, including the only master's programs for both clinical neuropsychology and organisational psychology in the state. So depending on your areas of interest, this is a great way to have a look at the career options and just kind of the course structure and entry requirements. So hopefully we can answer some of your questions today. Before we begin, I'd like to acknowledge the traditional owners and custodians of the land. We're currently on Wallamadigal land of the Darug Nation. So now I'm going to be talking to Associate Professor Philip Gilchrist, who is the course director for our Masters of Clinical Psychology. So welcome.
Thank you.
So we have had a bit of a conversation before about with our other 3 course directors for the Masters, where we spoke a little bit about our opportunities and about kind of what careers you can go into, the pathway to becoming registered. So kind of going to that special neuropsychology, but then also the broader areas that you can do in professional and organisational. So I guess with clinical psychology, what can people that are going to pursue that kind of find themselves in the career space?
Well, clinical psychologists become experts in assessment, diagnosis, and treatment of a wide range of psychological and mental health issues. So as such, they could be involved in a wide variety of settings as well. So for example, community-based services, private practice, private clinics, hospitals, and so on. But an important point to make is that it's not just psychotherapy. So clinical psychologists could work as well in consultancy, public health, forensic testimony, program development, that sort of thing as well.
Yeah, so I guess it is a common misconception that psychotherapy is the only thing.
Sure.
So I guess my next question then is for things like the placements and the internships in that master's program, do students get the chance to kind of have a bit of a broader opportunity to explore kind of their specific interest in clinical psych in those placements?
Definitely. So we have 3 placements in our program. 1 is internal, 2 are external. The external ones vary widely. So the areas I mentioned earlier, private clinics, hospital settings, schools, and so on. These are representative of the types of external placements we have. And students have some degree of choice in determining where they end up for their 2 external placements.
Yeah, so I guess another question for you is, what do the entry requirements look like for our clinical psych masters?
Right, so it's similar in some ways to the other programs. So we're looking for first class honors or second class division 1. We're also looking for, in addition, you'll see this in the supplementary form, we're looking for information about the type of relevant experience that you may have had. If it's relevant is a subjective term, so any type of experience you do have, please describe it. But if it's something that's relevant to the area of clinical psychology broadly, then I'd encourage you to emphasize that point. So for example, many of our successful applicants have had experience with Lifeline, and there they may not get many hours, they might get a few hours every other week or so, but it's an excellent example of a good experience because there's some training there, it's client-facing, and they're applying some of the skills they've learned in their undergraduate to a workplace setting. So that's what we're looking for. We're not looking for anything beyond that. So we're not looking for having experience in conducting therapy, of course, nothing like that. But I think that would be a good example, something like Lifeline. Yeah.
So I guess for people that are going through to kind of pursue that or go through those entry kind of processes, why do you think that they should kind of consider Macquarie specifically?
Well, I think there's a number of advantages at Macquarie. We, as I mentioned, have that in-house clinic. So it's unique, and it does place students with an advantage when being sent out to those external placements. So because of the in-house clinic, first placement, they've had close supervision for an extended period of time, many months, to upskill. So by the time they're heading out to their external placement, they've gained some confidence and some skills in a variety of areas of assessment and some therapy as well. So that's one advantage. Another advantage is the team that we work with. So I think we're a great team. We're down to earth. We're not just academics. Our team are all experienced clinicians as well, from a variety of different settings. So we have experts, leading experts in different areas such as anxiety disorders, PTSD, for example. We have experts in OCD, child health, adult mental health, as well as clinical health psychology. So a variety of different expertise in our program, and an emphasis on not just the academic features, but the applied features.
Yeah, great. Well, thank you for coming to chat with us today, Phil.
Oh, thanks for having me.
So that's about time to wrap up now. Thank you to all of our course directors for coming and having a chat with me today. Hopefully this has kind of answered some questions and kind of given an insight into the pathways to becoming registered and some of the entry requirements for maybe joining one of our master's programs here at Macquarie. So if you have any further questions, please don't hesitate to contact us. But thank you.